Monoclonal antibodies can identify cancer cells through a specific protein that is on those cancer cells. And so once the monoclonal antibodies identify the cancer cells, what happens is that it signals the immune system to attack those cells or eliminate them. So in other words, monoclonal antibodies really trigger the immune system to attack the cancer cells.
I'm a nurse practitioner at Emory at Winship Cancer Institute, and I specialize in multiple myeloma and have for up close to 19 years, actually. And so our center has been very big in bringing out monoclonal antibodies, and we've been using them for years. We've had patients on monoclonal antibodies for years, and on clinical trials, and now in the relapse setting, and it's one of our main go-to newer drugs at this time.
So in my center, in the relapse refractory setting, about 1/3 of our patients are on monoclonal antibodies. In the upfront setting, newly diagnosed patients on monoclonal antibodies are generally in the setting of a clinical trial.
In our institution, we're seeing monoclonal antibodies used more and more. It has been almost revolutionary to see how far we've come in myeloma over the last 15, even 10 years ago. Monoclonal antibodies are now being used more with other backbones, and we're seeing synergistic responses.
In my experience, patients have tolerated monoclonal antibodies extremely well once you get them through the first dose of therapy. We've been using monoclonal antibodies for years in other types of cancers, and so it made sense for the development and the role in myeloma. You know, there's been a big change in myeloma over the last, especially 12 to 15 years with so many new therapies. But I think that monoclonal antibodies are the ones that we're really adding on the most at this point in therapy.
Tolerability has been phenomenal. Monoclonal antibodies have a different side effect profile from some of our traditional therapies, and so patients find that very favorable. In terms of efficacy, we've seen quite a bit of good responses from this, which is really exciting in a disease that even in 2017 is considered incurable.
In our institute, the use of monoclonal antibodies has been overwhelmingly positive. It's especially encouraging efficacy that we see in the heavily pretreated multiple myeloma patient. So for example, daratumumab in combination with lenalidomide and dex, and daratumumab in combination with Velcade and dex were approved this past November 2016 with a new indication by the FDA for patients only need to receive one prior therapy in order to receive these two therapies. In both of these clinical trials, which were pivotal, patients in the daratumumab, lenalidomide, and dex had overall response rates of over 90%, and they had a doubling of their complete response rates. Likewise, in patients receiving the daratumumab in bortezomib in dexamethasone therapy, those patients also had over 80% of overall response rates, and they also had a doubling of their complete response rates with their patients. And with the elotuzumab in combination with lenalidomide and dex, they also have about an 80% overall response rate.